Good afternoon, ladies and gentlemen. As you are aware, it is now just over 24 hours since it was announced that Barbados had recorded its first 2 cases of coronavirus, COVID-19. And as you are aware as well, the Prime Minister has promised that everything will be done to keep the country informed on developments with daily press briefings. And this essentially is the first of those briefings. And with me is Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostick, and Acting Chief Medical Officer, Dr. Anton, and they will answer your questions. So feel free to go right ahead with your questions.
All right, my first question, can you give us an update on the 2 people who have been diagnosed? What are their conditions? How things went with this?
The 2 persons that we would have reported as confirmed cases yesterday are both in isolation at our isolation facilities and being treated in terms of the coronavirus.
Mr. Bostick, these 2 persons were they screened at the airport at the port of entry? Also, as relates to testing, in the US, we see a case where the lack of wide-scale testing has placed the US behind the 8 ball as it relates to getting ahead of the virus. What is our capacity to do wide-scale testing? And if we are not at that capacity at this moment, when will we be there?
First of all, both persons would have been screened at the ports of entry. But remember, when persons arrive at our ports of entry, they are tested in terms of the temperature by use of the temperature machines that we have. They are looked at also by the persons who are doing the surveillance. And if persons show symptoms of COVID or flu-like symptoms, or indeed if they have high temperatures, then they are removed and they go and they are seen and investigated by a port health nurse. So if at the time of arrival you do not present with symptoms and you don't have a temperature that would create an alarm for us, then at that point in time for us, then you are allowed to go through. But however, if you develop the symptoms having reached your home, your hotel or wherever, then that is when we ask persons to report to a medical facility by telephone or to call a private doctor, and then that is how we are able to deal with it from there.
As it relates to the testing?
As it relates to the testing, our emphasis has been on surveillance and enhanced surveillance, because we believe that if we can detect it at the port of entry, then it would reduce the need for testing at that stage, bearing in mind that test kits are limited globally, and we have to operate within the confines of the resources that we have. So we do selected testing based on your travel history and when you present with symptoms. And that is the policy that we've been following so far.
Minister, can you tell us how many persons have been tested in the last 24 hours and how many test kits we will have available now?
I can tell you that we've tested about 13 people yesterday, and there are 11 persons who are due to be tested today. Those persons who were tested yesterday were all negative. In terms of the testing kits, we have increased our capacity through some kits that were presented to us by PAHO. And the government of Barbados is in the process of purchasing a lot more kits. And the first set of kits that we are going to be purchasing, those kits are due to arrive on the 4th of April, with another set of kits coming in a few weeks after that. And we also have a third set of kits. So this is a continuous process, and we will purchase kits depending on, purchase a number of kits depending on how the situation develops.
What has been the update with the contact tracing of the people who came in?
So contact tracing